We can also, if we want, do another maneuver called a Semont Maneuver, and this might be more appropriate for the patients who we don't want to put into that Epley position, which is pretty damn uncomfortable if you've got a bad neck.
Yep.
So we could do something called a Semont Maneuver, which involves speed rather than positioning. So we use centripetal force, if you like, to whip the crystals around the canal. It begins with the modified Dix-Hallpike. So again, if we say we're going to treat the right posterior canal, so if you twist your trunk around that way, and we're going to go down onto this shoulder first of all, and then bring your legs up onto the bench. So we'll go on 3. 1, 2, 3. And it looks a little bit brutal, but in actual fact, the very sort of fragile little old ladies or the big builders cope with it fine. Hold this position for a minute. It would probably be provocative, so you'll get dizziness and nystagmus. Once it's all settled, we know the crystals have reached the lowest part of the canal, therefore it's time to move again. So position 2 is a fun one. You're going to go as fast as you can onto this side. So you're going to drop your feet off the edge of the bench there. You're going to sit up as fast as you can and go all the way over to the other side, but keep your head and body twisted to the left slightly. So you'll end up with your nose down on the bench. Let me show you. You just help me. So you're going to sit up as fast as you can on 3. 1, 2, 3. Up and down. That's it. And we'll stay there. And you can bring your feet up onto the bench if you want. That's good. And so that's the Semont Maneuver. So we're looking for speed as fast as you can. In this
I'm
situation.
guessing that because you didn't do this straight away, that this is less effective generally than Dix-Hallpike.
You just bring your legs over the side.
Or Epley, sorry,
and
I
sit
should
yourself
say.
up. The results are pretty similar.
Right.
It's less well known, therefore nowadays everybody's Googled, everybody kind of almost wants to have an Epley Maneuver because that's the one they read about. So I tend to do the Epley first. It is perhaps a little bit less effective than Epley, but sometimes it's more effective. So there are some situations where the crystals are a bit sticky and they don't just drain with gravity, and you need the speed.
Okay.
So sometimes I will do a Semont followed by an Epley and as a pair of treatments.